Well, hi, friends. And for those of you coming back, welcome back. And for those of you just joining us, it's nice to have you with us. 7 months ago, me and some great panelists got together to talk about kids, COVID, and the new abnormal. It's part of Girl Power Hour that we've been doing with the Lionheart Foundation. Then we said, in 7 months, we're going to get back together and see what's changed and see how things are sitting. And that's why today is called Exiting COVID, Anxiety Amping for Kids. And this is an ongoing support for parents and for families who are dealing with adolescent anxiety and want help. And this is a session for you. So we're going to talk to the same panelists and same experts we talked to 7 months ago and find out what the trends are, what they're seeing. Is everything better? Is it stressful? Is it more? Where do things lie? We'll be chatting with them. And if you missed November, or missed part of this one, don't worry. You can find them on the Lionheart Foundation page and on the Girl Power Hour page. They'll be there. You can review them, send links to friends, and make sure that everyone who needs help gets help, which is the whole purpose of today, is to be sure that if you're feeling isolated, if you're feeling afraid, if you're anxious about your kids, or if you're a young person and you're anxious, this is a great place to be because you're not alone and there's lots of folks to help you. Now, the Lionheart Foundation puts this on, and we are thrilled to be able to welcome back the Executive Director of the Lionheart Foundation just to get an update from her, Jamilah Edwards. Welcome. It's great to have you here again.
Thank you, Dave. It's great to be here.
Now, I have pages of questions for you, but I'm going to limit it to one page if that's okay with you. If people don't know the Lionheart Foundation, tell us a bit about what you do.
Yes, thanks you. The Lionheart Foundation is the only adolescent community-based mental health organization that focuses on anxiety and internalizing anxiety in Calgary and area. Our focus is to ensure that any young person in Calgary and, like I said, in any of the surrounding areas can get access to treatment when they're facing anxiety or an anxiety-related issue. And we do that in an affordable and timely way by connecting them to a trained therapist who's able to see them, someone who is well versed in adolescent mental health and how to treat anxiety. And we do that across the city. And we also focus heavily on building capacity. So we focus on training and local clinicians within the mental health space on how to treat young people who are facing anxiety and anxiety-related issues.
And now I know from when we did this last time, not only are folks in this area in Calgary using this, but if you're watching this from anywhere else and you're concerned, don't worry. When we chat with our panel, I'm going to find out about some online resources for you. But there's so much for the folks here that you folks do. Can you tell me a little bit about, we're going to talk to our panel about trends they're seeing. What trends are you seeing?
Yeah, certainly. So one of the things that we seeing right now is that the pandemic really exposed this issue of anxiety in young people. So even as we exit the health, emergency of the pandemic, we are very much in the middle of a youth mental health pandemic. So we're seeing that in the form of just an incredible increase in the number of families and young people themselves reaching out for help, specifically citing anxiety as an issue that they're facing. In addition to that, we're seeing that the cases are a lot more severe than they were prior to the pandemic. And of course, all of this is happening at a time that it's a very stressful overall time for families. So we're seeing the level of financial need increase. Approximately 60% of the people who are reaching out to us are financially stressed or they're lower income, needing a higher level of support. So we're seeing multiple things combined, but overall, we're seeing a greater need than we've ever seen before.
That can be scary to hear. However, the Lionheart Foundation is there to help. And so if families are thinking, I don't know, maybe I should call somebody or I should do something, they can reach out to you, correct?
Of course. And so we encourage any family in the community that's having any concerns around a young person or with anxiety, or even if it's not related to anxiety, to just give us a call. We can be reached very easily at 403-978-5866. If they'd like to speak to someone right away to talk about their young person, they can also call our 587-900-6355. That's our intake line directly. And of course, they can also email us at intake@lionheartfoundation.ca or info@lionheartfoundation.ca.
And of course, all that's on the website. If people miss it or want to go back at a different time to find it, it's all there.
It's all there.
Jamilah, you're running a great organization and you're doing such a great job, and we're all so grateful. I know our family is grateful, so thank you very much for what you do.
Thank you, Dave. Have a good day. Bye-bye.
We will. Now, before I get to the panelists, and speaking of thank yous, I did want to mention that 7 months ago and this event, that the Friends of Girl Power Hour are 51 companies, some local and some national, who got behind this. And they and many of you were part of being able to raise $500,000 to put directly towards adolescent mental health. So we want to thank very much the Friends of Girl Power Hour. You do make a difference. And there are young people and families out there right now whose lives are immeasurably better because of what you do. So thank you so much to our Friends of Girl Power Hour. And now let's bring back our panel of experts. And I want to say first, April and Raechelle and Danelle, welcome. I'm going to read your intros because you're well worth reading. So Dr. April Elliott, pediatrician, adolescent medicine specialist, 20 years of leadership developing adolescent health as a subspecialty. It's what you do, author of multiple publications on eating disorders, adolescent brain development, and youth experiencing homelessness. I could talk a lot more about that, but April, thank you so much for being here.
Thank you so much. It's such a pleasure to be back with the team, and I'm really looking forward to the conversation today.
It's going to be great. Raechelle Paperny, registered psychologist with her doctorate, over 30 years in the mental health field, university professor, researcher, consultant, speaker, therapist, and good person. I put that last one in, but I think it's true. Welcome back. It's good to have you here, Raechelle.
Thanks, Dave. And thanks for Lionheart for following up on this really important topic.
Danelle Spence, also registered psychologist, over 25 years experience working with youth and families in children's hospitals, eating disorder clinics, adolescent specialist center, private schools, private practice, author, speaker, and former teacher. Danelle, welcome back. Nice to have you here again as well.
Hi, thank you.
Well done.
I'm looking forward to the conversation as well.
So right out of the gate, April, let's start with you. What are the trends you're seeing? Are cases rising?
Well, we're talking about anxiety-based things, and so that's such a large topic. But I would say specifically from a pediatrician, adolescent medicine specialist at a tertiary care hospital, the thing that we've really seen an increase in is severe eating disorders. And so young people that are coming are younger. They're more ill when they present to the hospital. And those cases over the pandemic, we saw a 150% increase in inpatient. We also saw our wait times go from 2 to 3 weeks for our outpatient assessments pre-COVID to up to 56 weeks at the height. So yes, cases specifically in eating disorders have gone exponential, and it's not unique to Calgary. It's national and international as well.
Wow. Danelle, from your seat, what is your perspective?
I'm just finding the clients that come through are having a lot more complexities. So they're more multifaceted. It used to just be, struggling with sleep or refusing to go to school or panic attacks. But now it seems to be a big combination of a bunch of things. So social anxiety, mood, a lot more mood stuff. So just feeling sad and helpless and hopeless. So a lot more of that coming across my plate in my practice, of course, and lots more physical stuff like stomach aches, headaches, stuff that it could potentially be physiological. Like a doctor may want to look at that. However, my belief is it's anxiety based, and it's showing up in headaches, sleep disorders. So it's just a lot more complexity.
And so folks watching understand, I'm going to pick on you in just a sec, Raechelle. I have got it all organized here, but it's important. If you're saying, what signs should I look for? We're going to be talking about that. If you're hoping for tips for what to do right now, given the situation, we're going to be talking about that. We're also going to see if there's any just general parenting tips for you. And then if you have someone you love who you think needs help, or your family needs help, what do you do? Where do you start? We're going to talk through that. So all of those things we're going to cover. Raechelle, some people might think that, well, we don't have to wear masks anymore. Social distancing isn't the same as it is. Everything's relaxing. Kids should be better. Is that what you're finding?
No, unfortunately. I'd like to think that we're still seeing an influx of cases and severity of cases because things have come out of the shadows, because mental health has been destigmatized recently. But I think what we're really seeing is that a lot of this was in the making pre-pandemic, but the pandemic really had the conditions that really brings about anxiety. You know, we had isolation and danger and threat and unknowns and loss of control. And so much of that puts us on high alert. And even though it's over, our bodies and our systems have been in this condition for 2 years that it's hard to just stop that and just re-enter. And, you know, in parents' efforts and schools to rush back in and return to normal, we have shell-shocked or unprepared kids for that re-entry and to just get down to work. We need some time for recovery, and therapy is one of the ways, but I think there's other tips that we can all use.
April, you tend to see the serious, very serious end of these. Do you see that as, okay, but in a month or two, it's going to slow down? Or if you were looking to your crystal ball, how do you see things going?
Mm-hmm. Well, I really appreciate what both Danelle and Raechelle have said. And, you know, I have seen this wave coming for years and years. And I said to someone, May of 2020, we're not even going to see the tip of the tsunami until a few years after. The impact that this unprecedented context have put around people have really taken away the typical coping mechanisms that families have had. Everyone's got a different baseline, but what we're seeing is very complex presentations. And I think that sort of trickles down is families don't even know, is this normal development? What's happening? And peers, everyone has gone through the same thing. And so I don't want to be a doomsday, but I do think that we are going to be seeing the impact on mental health for youth, children and youth and adults for many years to come. And I think, but there is hope. And I think today we'll talk a little bit about that.
Yeah, we will. And the biggest hope I feel, and I hope for those watching, is you're not alone. And that's why the Lionheart Foundation is here. Raechelle and Danelle, you both sort of touched on this, but is it different than 7 months ago when we talked? Is there a difference in how things are presenting or combinations? How does that for either way? Raechelle, why don't you start?
I would say with things reopening for people that had, or young teens or young adults that I'm working with that are re-entering back to school, if they had pre-existing anxiety, sometimes they were kind of numb to how stressful their lives were, and they really enjoyed the slowing down of the pandemic to a certain degree. And the re-entry has been like a blast for them. So I'm seeing a lot more of them just saying, I'm overwhelmed, it's too fast, and I'm having panics. I just am feeling huge pressure to perform. And so I'm seeing that. And I'm seeing a lot of avoidance as well, where just the re-entry has been really hard for people in the sense that they just can't re-engage. And so I've got parents saying, what do I do? You know, they don't want to go out and get a job, or they're too uncomfortable. There's a lot of fears and phobias of avoidance right now that I'm seeing as well.
Yeah. That's what I want to tag onto what Raechelle was saying, is that a lot of these typical developmental milestones, like having a sleepover, getting your driver's license, going to a party, you know, as an older adolescent, there's a real stall based on fear, based on anxiety, based on the potential to have a panic attack. And so and parents are accommodating that. And I know we'll get to some of that, some tips and tools for parents, but why wouldn't parents accommodate? They've been through a lot. So yes, let's make it easier. Let's help them. But that's not necessarily helpful. But there is this stalling of some of those experiences, which is just perpetuating more anxiety, more fear.
We will talk about tips for how to deal with that in a bit. Raechelle, are you seeing any positives in any of this?
Yeah, I mean, as we've just been setting up, there's a lot of concern here and a lot of need and a lot of severity. However, there are some positives, and those have been, this slowing down has allowed families and therapists to be able to work with people during this time to get to attend to the things that weren't working. And I think the pandemic brought about challenges, adversity that inoculated, just like our vaccines do, with enough stress and enough hurdles where people had to hone their emotional regulation and different challenges. So they are, we can call it post-pandemic growth, post-traumatic growth, where now it's a green light and a lot of young people are just being able to take off and go and launch. So I am seeing that too. And that's in my practice and around in my social world, which is really hopeful. That part's nice. Yeah.
There is hope. There is hope. I want to talk about signs for parents, and then we'll get to some tips for parents or things you can try if you're worried. But April, let's start with you. If you're wondering, for me with my kids, what should I be looking for to say, okay, this is something you should be aware of? And we'll let the other two jump in as well.
Mm-hmm. Well, I think it's really important to delineate the difference between a severe presentation and someone having a normal physiological response to a stressful event. But to really point out the things we should be concerned about are things such as weight loss, if we notice that there's any self-harm on the young person's body, if there are things that are coming up, their worry and their symptoms are interfering with their function, so they're not able to go to school, they're not able to participate in activities. When a young person that's absolutely loves something is dropping out of that thing, those are the things we really want to be mindful of and parents to look into a little bit further. But I think, I really do want to be hopeful, the glass is refillable, that we look at sometimes this is a way of building up our resiliency and understanding how to emotionally regulate and move forward in sort of this new environment that we've been presented with.
Danelle or Raechelle, anything to add as far as signs to look out for?
Yeah, a lot of what April is saying, and any significant changes, like your child best, and so anything just out of the abnormal. The other thing that I've just been realizing is that recognizing the difference between routine and structure and rituals. And I know that's sort of a weird thing to say, but what if they need their toys lined up really perfectly before bed in order to sleep? That's a precursor to anxiety, right? So having everything be perfect, like I need to hear you say I love you 5 times before bed, otherwise something bad is going to happen. So looking at, kids absolutely need that sameness, that routine, that comfort and of the structure within their day. But when it becomes more ritualistic, very patterned and necessary for them to settle, that's just something to pay attention to. It's not always cute that they have to alphabetize their CDs before they can sleep.
Right.
CDs. I don't know. Do kids even have CDs these days? Sorry, I just aged myself. But it's not cute. It's okay.
Yeah.
You are doing this to settle, and it's a flag.
It really is this balance, and I think it's captured here, but it's what even these things that we can think is a good thing, like reorganizing their room or being tidy or spending extra time on school or eating healthy, can really run away with itself if it's based on an anxiety underlying it.
Yeah, totally.
You mentioned too, I think it was Raechelle that mentioned about physical symptoms. So like headaches and stomach aches. April, and you see folks in emergency. Is it possible that is more anxiety than actual headache? Or you know what I'm trying to say?
I am so glad that this is being brought up because one of the number one reasons that even adults go to the emergency room is they think they're having a heart attack. And oftentimes it's a panic attack. So our bodies talk far before our emotions often do. And so anxiety itself can give you breathlessness. It can give you chest pain. It can cause your heart rate to increase. You can get stomach aches and indigestion. And you really feel like there's something physically wrong with you to the point where sometimes you think you're having a heart attack. And so I think it's really important for people to understand that mind-body connection, and that this is a physiological response to a stressor, to a fear. And where we're going with this, if we start to pathologize it, instead of helping people understand how to manage it, I think we're going into a really dangerous place of making those symptoms be something else. And so we want to help people manage them. We want people to understand how to manage them as well.
And you know what, April? Oh, sorry.
No, go. Yeah.
A lot of parents will say, but is it a panic attack? They were just sitting having supper. There wasn't anything to be stressed about in that moment. And it doesn't always have to be, this happened, panic attack, right? It's just that if their bodies are in this persistent alarm state, it's only a matter of time before it starts to kind of shut down, and it looks like a panic attack or an anxiety response, when really they might have just been chilling playing Mario Kart, right? Right. Again, I think I aged myself with the Mario Kart. But.
I have to say, you bring up an excellent point, because some of the young people that we see in a specialized clinic where they're experiencing what we call somatic symptom and related disorders, when they have, when there's testing done on them, the neuropsychologist said they're actually like fighter pilots. When that young person is sitting in front of them saying, I'm not anxious, I have no stress in my life, I'm not anxious, their biometrics are showing that they're like fighter pilots. And so I love that you brought up that point, because so many people will say, there's nothing to be anxious about now. They say they're not anxious, but their physiology is very anxious.
We could talk about this for forever, but I want to go to tips and advice for parents, because I feel like this is where so many folks are tuning in for. And I wrote down, this is one of my questions, and a lot of folks have asked this. How do I know between overly accommodating and avoiding? And how do I help my young person if I feel like there's something going on? Danelle, why don't you start on that about how do I tell what I'm doing, if it's helpful or not?
Well, and I can absolutely understand why parents would want to overly accommodate and overly protect. And however, it isn't that you do have to provide a bit of uncertainty and have some risks as you grow up, and your children have to experience that. So I guess it's something like, if your child says, I'm too scared to go to that sleepover, go, okay, do that, connect emotionally. But then you have to redirect it. So say, yes, absolutely. It's a lot. You haven't been to a slumber party in 2 years, but let's make it a little bit easier. Let's go to a cousin's for the night. Let's go to grandma's for the night. Let's scaffold it. So you do small risks a lot, and get them to build their mastery and their inner competency, like going to a cousin's, waking up and going, oh, I did it. That feels so good. I took a small risk. It worked. It builds their confidence. And so it's same with the driver's license. I don't want it freaks me out to be behind a car. It's like, oh, absolutely. That's super scary. You're not used to it. Let's practice more. But it's not really negotiable. We need you to get your driver's license by 17, perhaps, instead of 16. So accommodate a bit, and weave in, like, you can do this. You've got this. And even if you as a parent are like, do they got this? Oh my God, their first slumber party. You've got to kind of pay attention to your fears, not planting seeds of anxiety onto your kids. Because if they say, I'm too scared to get behind a car, you're like, yeah, I know, me too. Oh my God. And then you're in the passenger seat and you're holding the thing and you're fake braking. Like, that's not helpful. So even if you're freaking out, take that to someone so that you don't plant those seeds of anxiety.
I find too, it's better to say, why don't we go home, listen to some CDs and play Mario Kart? I just think that
right.
Yeah. Now, as a parent, do you ever see parents who are, because I think what I would tend to do is either overprotect or go, well, that's just part of being young and I'm busy with my own life and I don't. Does that happen as well? Is that something I should be aware of? Anyone who wants to jump in on the Dave issues?
Can you clarify that a little bit, Dave?
Like, let me tell you a bit more about me. No, but Is there the potential of parents saying, well, that's just part of life, and it's part of, and I don't get involved and I don't ask questions and I just let them on their own? How do I know when?
Absolutely. And I think the only way you know is because that's what a lot of parents do. They just think, well, I remember my parents weren't really paying attention to me, and I think they've got this. And as April was talking about, a child on the outside can look like, wow, they can just go through the motions or high performing, but there's a huge anxiety underneath that is debilitating, and left unchecked is going to be extremely high risk and dire circumstances if it keeps going. So I think it really is parents slowing down, observing, recognizing, checking in, asking, looking where their attention is going, watching their behaviors, offering that safety and reassurance to talk about things and to get to know. And as Danelle said, you can validate the emotion and say, yeah, it's scary, but the reality is, validate their fear, but not the actual item like driving. Driving is okay. It's safe. That part is good. The reality of it is not true, but your emotional reaction makes sense. So let's figure out a way with support and that scaffolding support to get there. And again, I can't say enough about parents really checking into their own emotional state, because it's contagious. So make sure you take care of that before you approach your child.
Yeah.
Like saying, like if your child says, I'm really afraid to make my own hair appointment, like shaming them and going, what? That's ridiculous. It's so easy.
I don't get it. Yeah. Mm-hmm.
Yeah. Like what? It's just, you just make a phone call. Like you don't want to plant feelings of shame, right? Mm-hmm. So like Raechelle was saying, name it. Like, I know that's hard. You haven't really done that a lot, but let's do it together. I'll sit beside you. I'll script it out with you. So just making sure that even though something comes really easily to you, or you may not totally understand some of that fear, not planting, why can't you just do this?
What about if they're not coming to me? So for example, if I notice things like you talked about, cutting or weight loss, chances are they're not exactly saying, hey, I don't know if you've noticed, but I've been cutting myself and it makes me, how do I approach it when I see something like that?
I think you make the implicit explicit, right? And I think so often there's unspoken things, and it requires a parent to let go of some of their fear and to go right in, the bigger, stronger, wiser, whatever it is, it's not too much for me. And so to go in and say, I see, there's marks on your body. Can you tell me about it? And what's going on? What are you feeling when that goes on? Can you put it into words? And start from there.
Mm-hmm. And I think,
go ahead, April.
Sorry, I think given that in addition to the tertiary level, I do coaching as well. And I think where I always start at that point is what's your understanding of what's happening? Be a coach. Parents should be coaches as well. They give that opportunity for the young person to explain what this is, what's happening for them, versus I see this, I'm assuming this. Making sure that they're, hey, what do you understand about what's going on? And is there something that I can do to help you or support you? So it's almost like compassionate, firm boundaries. I'm here for you. And I'm also open and flexible to what's happening with you, versus young people often say, my parents just assume it's X, but maybe it's X, Y, Z, A, B, C.
Right. Okay. Again, there's thousands of questions. I know starting sooner and jumping in sooner is better than waiting. You're going to have better results. But are there any other just sort of tips about this specifically, or in general, that you would say, if I tell anything to parents, it's this? Any one of you have any thoughts on that?
Don't avoid all risks. Right. Have risks. Daniel Siegel, I'm going to botch this quote, but I think he says the only thing worse than taking risks as an adolescent is not taking risks. Right. So just, you can avoid all risks and they need to take them. And obviously not driving on the highway to Canmore in the middle of a storm when you're newly driving, but other risks, go to that party. Go grocery shopping on your own, order at a restaurant by yourself, like those small risks. And then as they build their confidence, they'll be able to do a lot more things with competency.
Raechelle or April, any other?
I would say go beyond the behavior and get to know what's happening internally inside your child. So often I'll hear, my parents don't understand, or they really don't even know me. And of course their parents know them. They've been with them through their whole life, but these young individuals are changing so quickly. And how they felt about things one day, or who's in their life, or what's important to them is always changing. So use those opportunities to find out, to ask questions, to observe and reflect it back and check with them. Again, make the implicit explicit, don't assume, and get their take on things. How are you making sense of that? How are you feeling about that? What was, all those sorts of things really help. And it helps saves lives, to find out what's going on inside.
Mm-hmm.
I think oftentimes as parents, because I am a parent as well, you want to fix things, right? That's sort of the typical medical model. You make a diagnosis and you fix it, right? And if the person doesn't follow through, then they're non-compliant. And I think more in a coaching, it's understanding and walking with that person and giving some guidance and accountability. There's something about that as well. That risk-taking is essential for normal development. You cannot individuate if you do not take risks. You will stay in your parents' basements and play Mario Brothers or whatever game it is if you're not given those opportunities to take those risks. And so you want to provide that. Yeah, you need boundaries for sure, but you have to give that environment where you trust them and allow them to take those risks. Like there's an old quote that says the cave we fear to enter often holds the treasure. Right. And so we can't do these things without allowing that bubble wrap to start to come off.
If you feel like there's more danger out there, or you're concerned and you want professional help, what do you do? Where do you go? How do you do that? Danelle, why don't you start us off?
Well, Lionheart and Lionheart's website has a chunk of resources to access. So blog posts and books, the tried and true books that based on what Raechelle was saying and what I wholeheartedly believe in, and I know April does as well, is that anything with emotional focused counseling. So learning how, as a parent, to be your child's emotion coach, how to listen more, talk less. So anything, because Googling, you could Google, my child is struggling, and you get a million resources. So anything emotion focused, but Lionheart has a good resource list. So I would certainly go there.
Yeah, I think Lionheart, because they take out a lot of that searching work for you. It's the great place to start, but also you're assured that those partner therapists come from an approach that goes beyond behavior. Mm-hmm. So yes, all of the therapists will use some form of cognitive behavioral therapy, but they go beyond that. So they're doing the emotional focus that Danelle was talking about, as well as body-based, talking to the body and bringing that into therapy. The mind and the body connection is so important, and probably the best way to work with young people too, because they're not going to want to sit back and just blabber away. They don't have the words and the vocabulary to be able to describe it. So I think you've got a lot of your work cut out for you when you look for therapists through Lionheart, but also that work in that approach.
I want to give each of you a final question, and I think I asked it last time, but I always find this helpful for me. And that is, when you think of the young people you work with and the families you work with and the work Lionheart does, what gives you hope? I'll end with April and start with you, Raechelle. What gives you hope?
I think being able to see change, the idea that our brains have plasticity and that experience is what shapes them. And so as much as when people come in, they're struggling, they've had experiences that have been painful, and they're caught in that vicious cycle, that there's always opportunity for new experiences to be learned and had that can repattern things towards health and growth and wholeness. So that's what gives me such hope.
Danelle, what gives you hope?
What Raechelle said.
Yeah.
That neuroplasticity, that the brain can change and develop. And if it feels like, oh my gosh, what is going on? Like my child is blah, like so much is happening. But I really believe in the brain's ability to change and heal. And you can walk away from things that you might think are going to be perpetual. And also just sometimes hardships, this is going to be a little bit cheesy, but sometimes hardship does create a different change in perspective and gratitude. And I mean, we didn't see grandparents for 2 years, and now you might appreciate grandparents, or, going out with friends to a restaurant and making good eye contact and seeing each other's mouths out from behind masks. So it's the small things that I think are quite helpful as well and offer me hope.
April, what brings you hope, or what gives you hope?
I'm just so fascinated by the human mind and our deep ability to have resiliency. And I love these conversations because I meet like-minded people, and I want to continue, to bring this message across, that as much adversity as we have, and we've had these past 2 years, there's so many positives. And if we can consider that, there's many proactive ways to address these issues and not try to label them as pathology. I have so much hope that there's more people thinking this way, and more parents that are interested in adolescent development and how do they help their young people proactively. So that's where my hope lies for sure.
What gives me hope is the three of you, and Jamilah as well. That I feel, and I mean that, you've been hope for our family. And just knowing it's, I feel like when I talk to you, I'm like, it's going to be okay. It might be rough, but it's going to be okay. So I want to thank the three of you so much, Danelle, Raechelle, and April, for being part of this, and also Jamilah and everyone at the Lionheart Foundation. And I should say, before I let everyone go, this November, we're going to go for a live event coming up. And so keep your eye open for Youth Power Hour. We're rebranding it, the 10th, that's going to be. What else do I need to say? If you need help, Lionheart is here. Go, and before I give all kinds of numbers, and we can put those up, just go to the Lionheart Foundation website. You'll get linked to anything you could want. You can also Google Girl Power Hour and go to their website and get links to everything you want. Help is there. Great people like these counselors and doctors are with you, and we are willing to help in any way we can. So thanks, the three of you, so much for being part of this.
Thank you.
Thank you. Thanks to Lionheart.
So again, thanks to the friends of Girl Power Hour, the 51 companies that stepped up and said, we want to help. We want to be part of this and doing so much for adolescents and the anxiety that they are going through. We'll be back, and keep up with the website. Go get in there and search. There's all kinds of resources for you. Thanks so much, everyone. Okay, time for bonus material. Did I miss anything? Does anyone have anything on a sticky or on a piece of paper that you wanted to say that we can get to?
You know what I didn't mention were my basement boys. Did I talk about that? Because we didn't talk about gender, which is fine. But one of the things that is a phenomenon is the basement boys that I've been seeing, because for so long I only worked with teenage girls and young adult women. And the basement boys are those boys that, hey, it's great. They're off busy. Everything's good. That's what boys do. They go down and they game, or they, go on the computer. And, it was so sanctioned during the pandemic that they really stayed down there and were reinforced for staying down there. And there was a lot of even our transactional stuff. You didn't go to a grocery store, you didn't go to a restaurant, you might not even have come up and had a meal. There was Uber Eats being delivered, there was Amazon packaging arriving on doorsteps. And, these boys already had a predisposition to not being relational and emotionally aware of themselves. And that was really stalled. And so there's that, they just need to be resocialized. And there's a lot of phobia and resistance to that. And parents are just going, what do I do?
Mm-hmm. And to go on to the tail end of that, I believe, and this is just one of my theories, is that interactive screen use is become very problematic. And it was ironic that we had a paper that came out just at the beginning of the pandemic talking about screen use and how, a young person and their parent comes in and how do you help them with that? And then all of a sudden pandemic came and it's like, that's all you're doing. You're just on screens. It's being endorsed in every aspect of your life. You're not even allowed to go meet your friend. You got to have a Zoom or a gaming with them. And I think that was endorsed. And so now, you have to reintegrate back into the real world. We already had the young people that were having those concerns, and now there's so many more. And I think that more families are like, how do we help our young people get off of this? 7.5 hours was was a study done in 2014. The average time kids were on cell phones and phones. Now it's exponential. And so I think that's another thing coming forward is how do we regulate, not just youth, but parents, how do we regulate this better going forward? Because we're addicted. So that's a whole other topic to discuss.
And that's if I get a young person in my office and they're there for anxiety or a mood disorder, I look at sleep and I look at screen time, because the study shows that more than an hour and a half outside of school and work of social media or scrolling actually activates more depression, more anxiety, more suicidality. And the fact too that so many more teens are coming in with ADHD diagnoses, which I find some are tried and true for sure, but some are also screen time related, right? The inability to concentrate and focus. It's, and then their marks go down, and then their self-esteem goes down, and then they become it becomes this whole big ball of everything. Like screen time is significant.
And then girls particularly vulnerable for the social media effects. Like it is insane. As you said, April, was prior to the pandemic, it's way worse. Now, I was talking to somebody who's doing makeup on grads this year, and she said they've never objectively been more put together. And yet they just can't stand themselves. There's a body dysmorphia because they're looking at all these digitally altered images of social media personalities, TikToks, Instagram, and they don't like anything about themselves. And she's going, wow, like she's not a therapist, but she just said, I've never seen anything like this that is so disconnected from reality.
Mm-hmm.
And I also think, I'm just going to throw a little bit of clinical in here, is that somatic symptoms and related disorders, which are anxiety-based, one of the related disorders are body dysmorphic disorder. Mm-hmm. And so you layer in technology and these messages and anxiety, bang. For kids, you might have toys lining up. Maybe for young teens, you have the perfection that needs to happen here and other places. And so it's so complex. And this is a whole other youth power hour.
Mm-hmm. Yes.
Okay, so that's really compelling. And I know for me, it's exactly how you say, and I have a son and a daughter, and they're falling exactly where you're talking about. But then what do you tell people? If you say, all right, this is what my kids used to do. If John had a choice between almost anything on earth and gaming, he'll pick gaming 99% of the time. So do I just say no, shut it off, let him have his tantrum and let him figure it out? Or what do I do?
You sit as a family and you go, let's do a reset. Like, let's not shame John, right? Like, let's look at a family and go, okay, we need a reset. We're coming out of this pandemic. And then you look and you go, okay, you're playing Mario Kart for 8 hours a day. Let's knock it down to 6. Let's knock it down to 5. And I always think of, let's not take away the technology necessarily. Let's just think about what the technology is taking away from them. Being outdoors, being with actual friends. Like, what is technology taking away versus what is it doing? Right.
I like what you're saying, Danelle, because so often it says all or nothing. Parents get panicked by what they're seeing, and then it just drives the relationship apart. It's at the cost of the relationship to save your kid from the dangers of technology. And you should never put anything at the risk of losing the relationship. So it's really about reframing. And as you said, maybe these incremental steps, not this all or nothing, no technology, and it's a punishment and all that kind of feel about it.
I see so many parallels with internet or screen use, or however you want to say this, interactive problematic use, is that it's like eating disorders. You can't take food out of someone's life. You need food. You need to sort of retrain their relationship with it. You have to have food, and hopefully food brings you joy sometimes too. And so it's the same with screens. We couldn't do what we're doing here today without screens. We couldn't, I mean, the things that make it helpful are also sometimes in excess that can make it unhelpful. And so it's about families. I love that. It's about families making a plan together and holding each other accountable. Man, I mean, I'm running workshops around these things for families, and it's usually the youth that are saying, I don't want my dad on the phone anymore when we're having good family meals. He's always on the phone, or mom's always checking Facebook, right? And so it's actually the youth that want some change. And so families need to come together and make these plans together and hold each other accountable. And that could be super fun too. It doesn't have to be punitive.
Yeah. Well, gosh, you just nailed something too. The family dinners, where have they gone? Right? Like, I know the kids have so many now because things have opened up. There's more overscheduling and there's lots of activities, and it's difficult. But ensuring 2 times a week, you sit as a family and phones far, far away, and you just connect and you establish and create and strengthen a good relationship with your kids, where you talk less and you listen more, right? But that time together, there's lots of research behind the positive impact of family dinners, even if it's twice a week, 3 times a week, right?
Yeah, and I think there's a real need there, in whatever form you can have it, for some sort of mindfulness recharging component, because our lives are not going to slow down. They are so fast. And so we need to put something in there. And, my kids are grown, but I did drag them to meditation workshops. And at first they liked parts of it, but weren't practicing. And I was just talking to my daughter today that's writing her licensed clinical social work exam today in New York. And I said, good luck. She goes, I'm just meditating. I'm like, win. So yeah, that was, what we model, April, like how we use technology, or if we recharge ourselves and do self-care and put these disciplines in our lives, it really does make a difference because they're watching.
I can't agree more.
Yeah.
I'm just writing all this down here. What I'm going to do is I'm going to go upstairs to Blythe and go, guess what I know? And I'm not going to give any of you credit. I'm going to pretend like I just learned this. That's great, though.
Dave, if you want, you can always just think, when things are getting really heated, you see a stop sign in front of you, and it's stop, take a breath, observe how you're feeling, and then proceed. But I will say that's what I do, especially when that amygdala is firing. I just see that stop sign, and I help my children as well. Stop, take a breath, observe, and then proceed. And I think that can help so many conversations proceed in a better way.